Hey guys, you're listening to By the Numbers, a public health podcast, and today we're talking about syphilis. Thanks for tuning in. Welcome to By the Numbers, a public health podcast. I'm Addie Olson, the Public Health Communications Officer with the Polk County Health Department. And in this episode, we're talking about a topic that you may have seen in the headlines because it's been on the rise for several years now, and that is syphilis. We're going to talk about a couple of numbers related to syphilis, and these are coming from a report that was released by the CDC earlier this year. And that report contained data about sexually transmitted infections from the years of 2018 to 2022. And during that 5-year period, there was a 79% increase in syphilis cases reported in the U.S. So a nearly 80% increase in overall syphilis cases from 2018 to 2022. And that is obviously a huge increase, but the next number is even more jarring. When we look at the number of babies who were born with syphilis, which means it was passed from the mom to the baby, also called congenital syphilis, there was a 937% increase over the past decade. So 3,755 cases in the U.S. in 2022 compared to just a few hundred cases just 10 years earlier in 2012. So due to these steadily increasing numbers, we're obviously a little bit concerned, and the impacts of syphilis, especially in babies, can be really devastating. So to help us understand what's happening with syphilis and talk about what we're seeing locally, I'm joined by my colleague Melissa Brown, a public health investigator with the Polk County Health Department. And Melissa, thank you for joining me.
Thank you.
And I wondered if you could start out just by telling us a little bit about your role as a public health investigator and what that looks like in action.
Sure. So as a public health investigator, what we do is follow up on the 4 reportable STIs, those being chlamydia, gonorrhea, syphilis, and HIV. Our goal is to help stop the spread of infections. We try to educate patients on transmission, how to prevent reinfection, work with the providers to make sure that patients are properly treated, and then we also interview them to see who else may be infected. Who are they having sex with? Who are they sharing needles with? Who should we reach out to and offer them some testing and treatment? And we also provide resources and education for both patients and providers.
And our public health investigators, your work is just so important because you're following up on not just the people who need to be treated for STIs, but also following up with any partners to prevent any additional spread of STIs. And then you're working with providers and other partners and just wearing a ton of hats in this role and doing that right here in our community. So I'm curious if what you're seeing in our community here in Iowa and in Polk County is kind of on par with this huge national increase in syphilis that we've seen in recent years.
Well, we're definitely increasing here in Iowa. We looked at the numbers from that same time span that the CDC report said from 2018 to 2022. Mm-hmm. And according to Iowa Health and Human Services report, Iowa is actually up 210% in our increase in syphilis. So we're definitely increasing, and even at a greater rate than we are seeing nationally.
And the same thing with congenital syphilis?
We are seeing a rise in congenital syphilis as well. We're seeing a rise in women who are infected with syphilis, which in turn can lead to congenital syphilis.
Okay, so it's safe to say that the trend that we're seeing nationally has been reflected here locally. And I think that we've been hearing about syphilis skyrocketing a little bit more lately, but I found it super interesting when I was doing some research for this podcast that the rise in syphilis cases is not new. This has been going on for a little while now. They started going up in like the late 90s, early 2000s, and that rate has not stopped increasing, even though this infection is easily treated with antibiotics. So do we have any idea why this is happening?
Well, I think there was a time back in the early 90s when we thought syphilis wasn't a concern anymore. Like, we've got this under control, rates are very low, we don't need to worry about it. Then when things kind of slowly rise, people don't notice it as much until we get these shocking numbers like we're seeing now. And now there's more focus on it. But ultimately, I think it just comes down to a lack of testing. We're doing less testing, or at least we were. Also, syphilis is hard to diagnose. It's known as the great imitator because the symptoms mimic so many other things that it can be misdiagnosed with. And, due to misdiagnosis, there's a delay. And then during that delay in being diagnosed, people are still spreading it, but they don't realize it. People sometimes get diagnosed with hand, foot, and mouth, or, they just think they have the flu, or, we talked about some sores can be mistaken as a number of things, an ingrown hair.
You can just find any way to kind of explain those symptoms away, right?
Right. So lack of testing, lack of education. We also had a shortage of bicillin, which is what we use to treat syphilis. So during that time, people were given alternative regimens, which then relies on the patient to be adherent to 14 to 28 days of oral antibiotics. So that can be tough to get the infection adequately treated. So there's just a lot of reasons. Another one is an increase in the apps that people use these days to have casual sex or anonymous sex. So tracking down sex partners once someone tests positive can be more difficult.
A lot trickier.
Yeah.
Okay, so a number of factors. You've got the dating apps or sex apps, and then we thought we had syphilis under control several years ago, and we clearly did not. A shortage of our number one treatment option, which is bicillin, and it's complicated. Like, it's hard to know when you have it. Exactly. So how does syphilis present? What are some of the signs and symptoms to be aware of, and what are some of the different outcomes that can occur?
Okay. So first of all, I want people to know that syphilis is sexually transmitted, but it's curable. If we know you have it, we can treat it. That's the best news about it. But some people may not notice any signs or symptoms. We do categorize syphilis. So what we would call primary syphilis would be the first indicator or the first symptom that you might notice. That is a sore. We call that sore a chancre, usually just a small open sore. Some people can get a few of them.
And this is like the very first stage?
Very first stage.
So at what point might you notice the chancre pop up?
That is typically about 3 months after an exposure.
Okay. So
that's another reason it goes undiagnosed as well, is because the incubation period is so long. 3 months after an exposure can be a long time. And you wouldn't think of a small sore as maybe as STI.
Yeah, like you said, could be an ingrown hair, or you could think of a number of ways to kind of explain that away.
Right. Could be in your mouth. You could think, I bit my cheek, or a number of things to explain it away. And they typically don't hurt, and they go away, even without treatment, so it goes away. So even if you did start to think, maybe that's something, then it goes away, and you're like, everything's okay now. So then it can progress to secondary syphilis. Secondary syphilis can cause a lot of different symptoms, but classic would be a rash. Some people get the rash on the palms of their hands, bottoms of their feet. It can be on the torso. You can really get the rash anywhere. Other secondary symptoms can be swollen lymph nodes, sore throats, headaches, weight loss, muscle aches, fatigue, hair loss.
A ton of things you would not think like, this could be an STI. I could have syphilis.
Exactly. Because most people think, I didn't have a discharge, so that's all they think of for an STI. But syphilis is just full of common symptoms that, we can feel when we have the flu or any number of things going on. Syphilis can also cause neurological, so you can get neuro-ocular or otosyphilis. A long time ago, they thought that these symptoms only happened after you'd had syphilis for a number of years or for a very long time. But we have come to find out that that's not true, and you can get these complications at any time. You can have them during primary, secondary, very early in the infection as well.
Oh, wow.
Yeah, so, neurosyphilis can cause things like headaches, changes in mental state, memory loss, confusion, personality changes. Ocular syphilis causes things like eye pain, changes in vision. You can lose your vision completely, go blind. The otic, of course, you can lose your hearing, have ringing in your ears, be dizzy. Syphilis can lead to death if it's untreated. But again, going back to the beginning of this part, it's curable. We can treat you. We know you have it. It can be treated, and we can move on from there.
Yeah, and it's heartbreaking to think about the fact that it can be prevented, treated so easily, and still people can live with it for a really long time and end up with any number of those issues those symptoms you just went through and those outcomes. And when we look at who is contracting syphilis and this increase that we're seeing, are we just seeing this kind of across the board, or who's really at risk of getting syphilis?
We are seeing it across the board. The increases are going up. So we do recommend any sexually active people get tested. But we are also seeing a steady increase in women, which is especially concerning because of the risk of congenital syphilis.
And so seeing more women with syphilis leads to that increase in congenital cases, which are particularly devastating. What are some of the impacts on babies who are born with syphilis?
Congenital syphilis is the same. We can prevent it. If we get moms tested and treated, we can prevent it. But if babies are born with congenital syphilis, they can have a number of devastating outcomes. First of all, it can lead to miscarriage or stillbirth. They could be born prematurely, have low birth weight, and they can die after birth, too. Babies can have bone deformities, enlarged livers and spleens, jaundice. They can have brain and nerve problems, and also the infant can be at risk to go have blindness or death.
And I think that we had looked at, so there's that national increase of 937% in congenital syphilis cases across the U.S. over the last decade, right? And then we looked at the state of Iowa data, and I think that there were around 20 cases in 2021 and 2022, which was way more, 200% more than we'd had in the previous several
20 years or something. Yes.
And it's just shocking that it's increasing at that level. And so do you think that, inadequate prenatal care could be the cause of women not detecting this, or can we kind of get to the root of that?
It probably has a lot to do with it, yes. But they have increased the testing guidelines. So now any woman who does have prenatal care should be tested at first visit, again between 28 and 32 weeks, and then again at delivery. So the guidelines have been changed to increase testing, which is what we want to see. That's the best way to detect it and get it taken care of, so babies don't have these outcomes, moms don't have these outcomes. But yeah, it is a concern that some women aren't in OB care and not getting this testing.
Yeah, I had read a report, I think it was from the March of Dimes, that in 2022, 1 in 10 infants born in the state of Iowa were born to women who did not have access to adequate prenatal care. And if you're not receiving that good prenatal care that all women deserve, you're not getting tested for syphilis, and that's an issue. And then even if you are getting adequate prenatal care and seeing your doctor and getting tested, you might not even know you're getting tested for syphilis. I had a baby a few years ago, and I can't even remember all of the things that I was poked and prodded for at those appointments.
That's true, yes.
So is it important, I guess, to talk to your doctor about that too when you're receiving prenatal care?
Yes, yes. I mean, always ask those questions. What exactly are you testing me for? What and you want to know the results too. But advocate for yourself as well. Just ask for the test. If you're not sure you're getting it, ask for the test. It's not going to hurt to throw an extra test in there and just get the blood test done.
And it looks different than a normal, or what you might expect with an STI test. It's a blood draw, right?
It is a blood draw, right? So sometimes I have patients who say, no, I was just tested for everything 3 months ago, and then, we go back and look, and they had urine testing done. Syphilis and HIV do require a blood test. So if you're not getting a blood test, you're not getting tested for all STIs.
Okay. And I guess how important is just testing for anybody and everybody? And then if that test comes back positive for syphilis, what's next?
Okay. So we really encourage routine testing, regardless of signs or symptoms. Just encourage people get routine testing. But if one of your tests does come back positive for syphilis, your provider will go over things with you. You will also probably hear from someone like me. But we're both going to talk to you about signs and symptoms. We're going to go over those. Do you recall any sores? Do you recall any rashes? Do you have any current rashes? Have you been tested previously? Because the treatment for syphilis depends on whether or not we can accurately tell if you were infected within the past year. The first year you have syphilis, you're infectious, and the treatment's less. So you would only need one shot. You would get a shot and you'd be treated. If we can't say for sure that you got it within the past year with those signs or symptoms, a positive partner, a previous negative test, then you would have to get 3 weekly injections of Bicillin. So treatment is longer, and so we would talk to you about all of that, get all your treatment figured out, make sure that you are adequately treated. Then the other part that someone like myself would do is just talk to you about who you're having sex with, how can we locate them. And when we do that, we do it confidentially. I notify people and say, hey, it's Melissa from the health department calling to let you know that you've possibly been exposed to a sexually transmitted infection. We do offer services at the health department for those folks. They can come in and get the testing and treatment done. But if people feel more comfortable going to their own provider, they can do that as well. We just try to notify people so that they can take care of their health. We want both the original patient and their partners to just be safe and have the best health outcomes.
So they're getting a call from you just to make sure that they're receiving proper care and treatment, to trace any partners that they've had and prevent any further spread or treat anybody who needs to be cared for. And you're not like reaching out and saying, hey, we heard that you had sex with Brian 3 months ago and he's got syphilis. You're being very confidential and saying, hey, you may have been exposed to syphilis. We want to make sure that you come in, get tested, and get treated if needed.
Yes. Everything is confidential with us. We would never notify, let them know when or where the exposure happened, who it was, just that we have their best health interests in mind, and we're just recommending that testing and treatment.
Got it. Okay, and circling back to the numbers, I guess how concerned should we be? We know that safe sex, testing, and treatment are key to stopping the spread of syphilis. What else can we do to kind of rein this in and get it under control?
So everything that you said is exactly what I wanted people to know. Yeah, but syphilis is on the rise. It's increasing. It's becoming, we're just seeing it a lot more often in Polk County, in Iowa, nationally. So just be aware, advocate for yourself, talk to your provider, ask for those blood tests, ask for your routine STD testing. Even if you're not having any current symptoms, just get the test. Sexual health is part of healthcare. So we really would like people to find a healthcare provider that they feel comfortable talking to about their sexual health. That's ideal. But also, the health department, we offer free and low-cost STD testing and treatment. We're there. We're a judge-free zone that you can come in and just get your testing done, and we carry all the medications right there. We'll take care of people if they do have a positive test. Also, condoms. Condoms, we always recommend those. And then there is a new medication now. It's called doxypep. CDC has recently come out with new recommendations on that. But basically what doxypep is you can get 200 milligrams of doxycycline that you take within 72 hours of unprotected sex, and it just helps to prevent those bacterial infections, chlamydia, syphilis, gonorrhea. So if that's something that you're interested in, we currently don't offer it at the health department, but we can give referrals to some providers that may be offering it, or talk to your own primary care physician and see if they are offering that. And also just get tested.
Yeah. Okay. Great advice. Get tested. Make sure that you're using condoms, and just to your point about a judgment-free zone, there's like a stigma there that just shouldn't exist, right?
Yes, exactly. Ideally, everyone would just be able to talk about their sexual health openly and honestly with their provider, but for some reason, some people just don't feel comfortable doing it. And that's unfortunate, because we do need to take care of our sexual health and feel that it's okay to talk to your provider about that. I like to think that we're a really great sex-positive way of addressing STIs at the health department.
Absolutely. All right. Well, thank you, Melissa. Make sure that you give us a call or stop by if you want to be tested. We hope that you do feel welcome to come and get tested. It's affordable. We don't want the cost to be a barrier. And we're there for you, right?
Exactly.
All right.
Exactly.
Well, that's what we have for today. And be sure to catch future episodes of By the Numbers on YouTube or your favorite podcast platform. And if there's a topic you'd like to see covered on the podcast, be sure to leave it in the comments wherever you're watching or listening. And we'll catch you next time. Thanks for joining us.